you joining us this afternoon. I'd like to begin with a few housekeeping items. First, this webinar is being recorded and will be made available online at longviewchamber.com. For those on the line, you will receive an email later today from Stephanie on our team with a link to listen to this presentation again. And we sure would appreciate it if you would share it with other businesses in East Texas. Next, there are a couple of features I would like to make you aware of. Please find the chat and question icons. You can type in both features to the organizer. The purpose of the chat today is to make the organizer aware there are issues with the broadcast. This presentation is going to be roughly an hour and a half, and if you have questions, feel free to put those in and we will forward those to our presenter after the presentation has concluded. Lastly, you will be muted throughout this presentation. It is important for me to share that my team and I are thinking of you during this difficult time. I recognize this is a painful season and our business community is looking for answers. We definitely are in uncharted waters, and while we don't have all the answers, we do have access to experts like Eva Turner, who is with us today. Eva is with Ogletree Deakins, Nash, Smoke, and Stewart PC. She is also a board-certified labor and employment law specialist. And at this time, Eva, I think I'd just like to go ahead and turn it over to you.
All right. Well, thank you very much for that introduction, and I am very happy to be here. So I think, like all of you probably on the phone, about 38, 40, 45 days ago, I was living my life, and things were pretty normal. I was planning a trip to Colorado for spring break with my family, completely unaware that around March 13th of 2020, my entire life was going to change, and all of our lives were going to change in very significant ways. And I think for us as employment lawyers, we can pretty much pinpoint the date when we stopped sleeping, which was about 35 days ago, because like all of you, we're dealing with the effects of this absolutely horrible and deadly virus, but we are also dealing with a massive amount of new legislation that applies to businesses and learning how to navigate that legislation, and then also to assist our clients in navigating that legislation. And while it has been a Herculean task for all of us as lawyers and as business owners and as employees and HR people, I can say that I've been incredibly honored to be working closely with our clients as we go through all of this together, and as we figure out how these laws apply to our workplace and how we can help our impacted employees as much as possible. So just to kind of go through the background on all of this, if you are the government, what do you do when you have a highly contagious superbug that can live for days or possibly weeks outside of a host? People spread it for days before knowing that they are spreading it, and there is no current cure, and the death rate compared to number of recovered is around 1 in 3. Well, if you're the government, I'm sure you are terrified to see these statistics, and you know that you are going to have to find solutions quickly. And that is exactly why we're here today, is to talk about what some of those solutions are. So what we have seen in terms of solutions for our workforce is first avoiding the spread. So both through government initiatives and through employer initiatives, we have seen workplaces change dramatically. We have seen efforts at fanatical hygiene, which of course is incredibly important to all of our workplaces. We have seen intense social distancing. This is how this all started, right? And then gradually over the course of the last month, we have seen rules regarding congregating, and then now where we are today, where most locations have shelter-in-place orders, where most, if not all, schools are closed, and where we have shut down in most places of non-essential businesses. Oh, it looks like my graphic didn't come through, or at least I'm not seeing it, but the graphic that should be showing right now are several rolls of toilet paper. Another thing that I certainly didn't think that I would be talking about on a webinar with all of you good people today, but when you shut down events, tell people they need to stay home, and close non-essential businesses, what is going to happen? That's the question that our government has had to contemplate. One thing that I don't think any of us predicted was that we would all run out of toilet paper. But that's not the only thing that was unpredictable as it relates to this virus. And the government has just worked to try to predict as much as they can about the impact of our businesses and our economy, and put methods in place to try to assist workers and their families during this time, and companies. There it is. There's the toilet paper graphic. Sorry about that. All right. So what is the government doing to help companies and employees through this crisis? Well, first of all, they are putting the economy on life support, and you probably have already heard webinars about that, and that does play into a little bit of the FFCRA, which is the bulk of what we're going to be talking about today. And then they put out a lifeline or a buoy to everyone so that we all can get through this together. Specifically, the government is forcing shelter in place, which has disrupted the economy. Many sectors have ground to a halt, as I'm sure you all are keenly aware. The government is trying to get money in the hands of Americans to keep them in their homes and fed without putting the employers out of business, which is a huge part of what we're going to talk about. And the way they have done this is by injecting money into the system and getting it distributed to the Americans who need it. And they've done this through 3 vehicles, among others. And this is what we're going to focus on today, is the first 2. The first thing that they've done is provide paid leave for employees in certain circumstances. And we're going to be talking a lot about that. That has been done through the FFCRA. And then they have also done this by having a federal overlay to unemployment, which has changed a lot of the state rules as we've known them dramatically, and really increased options for employees who are out of work. And we'll go over that towards the end of the presentation. And then they also have worked to get direct checks out to individuals who qualify based on salary ranges. Anecdotally, I have heard of some people who have already received their stimulus checks, although it does seem like most have not. So those are the 3 ways that the government is injecting money into the system for our purposes, and we'll be focusing really on the first 2 during this presentation. All right, let's talk about the Families First Coronavirus Act stimulus package. It can be really broken down for the purposes of this presentation into 3 different buckets. There is the EFMLA, the emergency FMLA, which has changed the FMLA dramatically, and we're going to talk about the nuts and bolts of that. It is for a short duration of time, and it is limited to COVID-related illnesses. We'll go through all of that. A second bucket is the FFCRA created a new paid sick leave, which is the EPSL, and that's how we'll refer to it during the process of this presentation. That is separate and apart from the EFMLA, although we will talk about how those 2 can work together to provide leave benefits for employees for a full 12 weeks. And then also the benefit to employers is that there's tax credits involved with you providing your employees with paid leave under the FFCRA, and we will talk a little bit about that as well. All right, so in broad strokes, the FFCRA provides two benefits to employers. The first one is it incentivizes states to loosen unemployment compensation and not have benefits affect the tax rating, which of course is what employers largely care about when it comes to paying out from unemployment funds. And we will talk about exactly how that operates at the end of the presentation. The second benefit to employers is that it creates tax credits for employers who provide EFMLA and EPSL to your employees. So again, I'm going to be using those terms throughout the course of the presentation. The EFMLA refers to the family portion of the FFCRA, and the EPSL refers to the sick paid leave portion of the FFCRA, and we'll go into those in some detail momentarily. However, it would be remiss of me to not remind everybody that there are other considerations outside of the FFCRA that we need to remember still exist before we ever get into the FFCRA requirements on paid leave. And I'm going to talk a little bit about those right now. This would be sort of the world that we lived in before COVID and before the FFCRA passed. So remember, when you are dealing with COVID-related or any other health-related illnesses right now, do not forget that you actually have policies in place, most likely, that apply to serious health conditions, that apply to needs for leave, personal, health-related, familial, however your policies read. You don't want to forget that you have those policies, and you want to make sure that you are abiding by them in everything that you're doing. And we'll talk a little bit about how those policies work within the scheme of the FFCRA, but I don't want you to forget that you do have those policies, and you want to make sure that you are abiding by them, and also that you can amend your existing policies to cover issues that relate to COVID if you feel like your policies are not appropriate under these very rare, unique circumstances. And so make sure that you are doing what you can internally to provide your employees and you what you need to be able to deal with this situation. Also, please make sure that you continue to monitor state and local leave laws, including paid leave laws. It's not just the federal government that's acting on this. State governments are acting on it too, and quickly. As I mentioned at the beginning of the presentation, we are sort of up around the clock right now, keeping up with not just the federal legislation that's been handed down, but also state laws that have been put in place that are related to COVID. I have one of my peers, I swear to God, she's up probably 2, 3, 4 a.m. every night just trying to keep up with all the state closure orders, because we have a survey that is in live time showing what all the state and local closure orders and changes to paid leave laws and things like that. So if you're a national employer, you just want to make sure that you are keeping up with all of that. And incredibly important and near and dear to my heart, as many of you know, is make sure that you remember that before COVID ever came to be, there was also a Family Medical Leave Act and an Americans with Disabilities Act, both that it predated anything COVID, and that I think was probably the biggest headache for a lot of employers in just trying to make sure they're complying with these before we got this whole new overlay that applies to COVID situations. And I just want to talk just for a moment as a refresher on the regular FMLA and regular ADA, so that that is in the forefront of your minds as you're navigating through all of this. As a matter of fact, some of you who are on the call, I may have seen you last month, I think it was back in February, when I was out in East Texas and gave a SHRM presentation on ADA accommodations. So this is an area where I just want to make sure that we all remember that it's there. So also, the pre-existing FMLA and ADA will and can still have ramifications and applicability related to COVID type issues. So remember, old school FMLA applies for a person's own serious health condition or a family member's serious health condition for the employee to care for that family member. Under the FMLA, a serious health condition is any illness, injury, impairment, or physical or mental condition that involves inpatient care or continuing treatment by a healthcare provider. So in the case of COVID, it may or may not count as a serious health condition depending on the circumstances for that particular employee. It may or may not count as a serious health condition for a family member depending on those circumstances. Also remember that the Americans with Disabilities Act could still and very well probably will come into play with respect to our current COVID situation. COVID could be a disability under the ADA depending on the circumstances. If you have an employee who is unable to work a certain schedule because of COVID-related long-term health issues that they've sustained, or they may not be able to do the essential functions of a particular job, you're in ADA territory at that point. It may be a temporary virus, but the long-term effects could create a disability. Also, one of the things that, as I'm sure you can imagine, we've been talking to employers about a lot is what do we do, temperature checks, and whether or not you can do temperature checks and other types of medical inquiries that employers really want to be able to do with respect to keeping COVID out of their workforce and keeping their workforces safe, especially for you essential employers out there who are continuing to operate. You want to make sure that you can do everything you possibly humanly can to keep people safe, but you can't forget that there are restrictions under the ADA on what kind of medical examinations you can perform for employees. So you just want to make sure that you are abiding by the ADA, and also with respect to leave as a reasonable accommodation, even separate and apart from what the FFCRA will require. Please also remember that you should inquire whether workers' compensation potentially covers employees who may acquire COVID while working. This will vary from state to state and may also turn on the state's definition of occupational diseases, but that's something that you at least want to explore if you've got a COVID situation with one of your workers. All right, so let's talk about traditional types of leave provided by federal law versus common COVID-19 situations. All right, so under the ADA, it is, excuse me one second. All right, under the ADA, the ADA typically cover quarantining of healthy persons? The answer to that is no, not typically, but it may in a COVID type situation. Also, care for family members with COVID-19. That would not typically be something that would be covered under the ADA, although if you are a national employer, you would want to make sure that you think about California, who has a slightly different approach to family members under the State Disability Leave Act. Isolation of those believed to be sick, that would not typically be an ADA triggering event. However, it is covered under the FFCRA, and we'll talk a little bit more about that. Those with COVID-19, I just touched on that. So even though it is a temporary illness, it can have long-lasting consequences for people, and it may affect their ability to do the essential functions of their job, and they may need accommodations related to that. So you just want to keep that in mind. High-risk persons who are immunocompromised and seek to work from home or take leave. This is an area where we get so many questions from our clients, because what do you do when you have employees who are in high-risk categories and you are an essential employer and you want those people to be able to work, and either A, they want to be able to work, but you are concerned about their health, or B, they don't want to work because they are concerned about working when they are more immunocompromised than someone who is not suffering from the ailment that they are suffering from. So those are hot button issues where the ADA is certainly implicated, even though this is a particular situation with COVID-19. Also, older workers who seek to work from home or take leave. So in the example of the immunocompromised, you're talking about a disability, an underlying disability. It's not the COVID that is creating the disability. It is the underlying disability that's potentially triggered by COVID. So that is covered by the ADA, and you will want to act accordingly. However, older workers, that is not covered by the ADA because being older is not a disability. And so that the ADA would not be triggered in that circumstance. However, remember that older workers are protected under the Age Discrimination in Employment Act, so you will want to make sure that you are following that law with respect to whether you have older workers staying home. Essentially, you will want that to be a voluntary act, but that is a subject certainly for probably a different webinar. But just so you know, the ADA doesn't cover older workers like it covers the immunocompromised. Does the ADA cover employees during government closure orders? No, that is not an ADA triggering event ordinarily, and neither are school closures. Those are triggering events under the FFCRA, and of course we'll be talking about that. So what about the FMLA? Would the FMLA normally cover quarantines of healthy persons? No, but the FFCRA does. Would the FMLA cover caring for family members with COVID-19? Yes, it would if COVID-19 is a serious health condition, because the FMLA does cover caring for family members. Isolation of those believed to be sick is very much a novel concept under the FMLA, but it certainly could be triggered. Those with COVID-19, possibly, if it becomes a serious health condition, and it probably already is under the circumstances and under the definition of a serious health condition that I read off to you earlier. High-risk persons who are immunocompromised and seek to work from home, yes, they would be covered under the FMLA if they needed leave. Older workers who seek to work from home or take leave, probably not under the FMLA, but they have other protections as we've discussed. Under the regular FMLA, government closure orders, no. School closure orders, no. However, they are covered now. So I wanted to give all of you that sort of primer of, first of all, remembering that we've got policies and other laws that relate to employees needing to take leave under these circumstances. You need to make sure that you are checking all the boxes when it comes to how you're treating these employees, not just the boxes related to COVID. And now we're going to talk specifically about Family First Coronavirus Act and how it applies to your workforce. Okay, so the FFCRA has a sunrise and it also has a sunset. So it became effective April 1st of 2020, and it will end December 31st of 2020. So for those of you who are out there asking if you have to provide paid leave to your employees for the rest of your life, the answer is I'm not sure, but I can tell you that it will not be under the Family First Coronavirus Act, because this is temporary in nature. Now, of course, Congress can extend it if they decide to, but for now, there is a sunrise and a sunset on the act. The FFCRA applies to schools, government employers of any size, and private employers with less than 500 employees. We have gotten a lot of questions on how the DOL interprets an employer with 500 employees or less. It is complicated, and even with the 70 plus FAQs that the DOL has published about the FFCRA, and we'll be talking about those throughout the course of the presentation, it's still a little bit confusing as to who qualifies and who doesn't. So starting from simple to more complicated, for purposes of either the EFMLA or EPSL, you start with your W-2 employees, so they are clearly counted, and then you add to that any temporary employees, leased employees, or other shared employees. That is how you get to your number of whether you are an employer who employs 500 employees or less. If you do employ 500 employees or less, then you are subject to the FFCRA. Now, the trick with this is that, and this is where we get a lot of questions, as you can imagine, is what if we are a large parent corporation and we have lots of subsidiaries? Do the subsidiaries count? How can we tell where to draw the line? Do we count every single facility? There's a lot of different iterations of ways. Either if you want to be counted, you can be counted. If you don't want to be counted, then you can find ways around being counted. So the way that we have been telling employers to count employees for purposes of the FFCRA is to use the integrated employer test under the FMLA portion of it to determine whether you should be counting subsidiaries under your numbers. And the factors of that test include looking at whether you have common management of business operations between the parent and the sub, if there's interrelation between those operations, if there's centralized control of labor relations. Courts have found that centralized control of labor relations when business entities share policies regarding hiring, firing, and training employees, and in developing and implementing personnel procedures, then they are integrated employers under the EFMLA or under the regular FMLA, and likely are under the EFMLA as well. Also look at whether there is a degree of common ownership and financial control, although that is probably the least important factor. So some of you are probably saying, well, wait a second, I heard that under the FFCRA, if you have less than 50 employees, you are not subject to the Act. Well, that may or may not be true, and here's how that works. You are subject to the FFCRA if you have 50 or less employees, unless you achieve an exemption from the Department of Labor. So you are counted until the Department of Labor tells you that you are not counted. The exemption is something that you actually have to apply for. And basically what they are going to look at is, according to the DOL FAQs, is a small business is exempt from certain paid sick leave and expanded family and medical leave requirements if providing an employee such leave would jeopardize the viability of the business as a going concern. This means a small business is exempt from mandated paid sick leave or expanded family and medical leave requirements if the employer employs fewer than 50 employees, leave is requested because the child's school or place of care is closed, or child care provider is unavailable due to COVID-related reasons, and an authorized officer of the business has determined that at least one of the three conditions described in another FAQ applies. And so you want to look at the DOL FAQs, which I'd be happy to provide you with a link if you have questions about whether or not you fit the exemption. I will tell you that the DOL has said that you need to make sure that you are documenting the reasons why you think that you are not that you are exempt from the act and that you can meet these criteria, and then you will apply to the DOL for the exemption. The act requires the DOL to pass regulations that will develop the criterion for an employer with less than 50 employees to prove that providing the paid leave for school closures in accordance with the act would jeopardize the business ability as a going concern. So I want to make sure that you understand that they are focused on whether it as it relates to school closures, whether it jeopardizes the employer's ability to do that and still be considered and continuing as an ongoing concern. There is a posting requirement under the FFCRA. I will give the DOL credit because they have moved very quickly on this. It's pretty amazing, actually. They do already have the posters. I have included a link to the posters on the presentation. And please know that one of, I think, the unique considerations about I'm sorry, my headphone is beeping and I want to make sure that I don't lose you guys. All right, I'm going to continue from my speaker phone because I'm worried that my headset is going to die. All right, so these are the perils of being away from the office for 30-something days and not knowing what's going on here while I'm gone. Apparently things don't charge. Okay, so, but continuing on. So I have been really impressed with how the DOL has handled all of this. And they already have notice postings. And one of the things that is unique about our current situation is that notice postings don't work in the ordinary way they would. So yeah, you can go and post these posters in the break room, but likely there is nobody in the break room to see the poster. So the DOL has basically said, and you're going to see this a lot through the DOL guidance, is that they want employers to act reasonably. They want you to make sure that you are getting the word out about the posting, and so you want to make sure that you are sending them to employees in a way that they will receive it. Make sure at a minimum that you're posting it on intranet and external websites so that you know that your employees will see those. You can email or direct mail them if you think that's the best way to get that information out there. All right, so what are the penalties if you don't comply with the FFCRA? Well, if you're familiar with the FLSA, the penalties for the EPSL section are the same as the penalties under the FLSA. So it's unpaid wages, an amount equal to unpaid wages as liquidated damages, and then also attorney's fees and costs. Remember, too, that an employee can get injunctive relief under the FLSA for an unlawful discharge, discipline, or discrimination, including reinstatement. So the kinds of damages that are available generally in employment cases as it relates to not paying for leave are the same types, or not paying an employee properly are the same types of remedies that are available under the FFCRA. All right, now we're going to talk about the EFMLA and the EPSL separately and go through the contours of each one. So let's talk about the EFMLA first. Here are the key points. So it is just another form of FMLA leave, okay? It is the same 12 weeks, so it's for 12 weeks in duration. It lasts the same time as the normal FMLA. The normal FMLA rules apply, If leave is granted and you are already an FMLA covered employer, any leave taken will count against the normal 12-week period. So we get this question a lot. Okay, the employee gets 12 weeks of FMLA under the EFMLA. Is that in addition to the regular FMLA? No, they get 12 weeks total. And so, so just so you know, if you've got an employee who's been out, who has exhausted their FMLA, then they're not going to get additional FMLA under the EFMLA. Now, they may be eligible for the EPSL, and so we'll talk about that in a minute, but as far as the FMLA, they've already exhausted it. Other than pulling out of the same 12-week bank, this law is different enough that it should not alter how you normally go about processing FMLA leave. So do what you've always done when it comes to processing this type of leave. And you do want to make sure that you are documenting that the reason the employee is out is because of they are on this EFMLA and why, and you want to have specific forms for the EFMLA as it applies to your employees. And again, happy to provide those to you if you would like. It provides leave for only one type of COVID-19 situation. This is, to me, how I crystallize why this leave is different than the EPSL. This is what we call schools out leave. It applies if the employee has a minor child, the child's school or daycare closes because of COVID-19 concerns, or if the child's normal paid care provider is unavailable because of COVID-19. As a result, the employee cannot work or telework because they need to care for the child. Incredibly important to remember that this only applies if the employee cannot telework. If the employee can telework, then this does not apply. They are not eligible for paid leave. So the EFMLA also changed the definition of employer, and that's now the definition that we talked about. It is for private employers who have less than 500 employees, and it is for schools and public agencies. The old definition of employer, though, still applies for all other forms of FMLA, okay? It just does not apply in the EFMLA context. That old definition is employers with 50 or more employees in 20 or more work weeks this year or last. That's the old definition. It still applies, except in the COVID-19 circumstance of the schools out leave. The expanded FMLA also changed the definition of eligible employees. So this is important. Any employee who has been on payroll for more than 30 calendar days is eligible for the EFMLA. Okay, so that is very different from the old definition under the FMLA, where the employee had to basically put their time in for a year or 1,250 hours before they were eligible for leave. Now it's just 30 calendar days. If they're not eligible when they request leave, then they can become eligible as soon as they hit the 30-day mark. So they can start work, ask for leave on day 1, you can tell them no, and on day 31, then they are eligible. The EFMLA is unpaid for the first 2 weeks. So as I said before, it's 12 weeks, but it's unpaid for the first 2 weeks. However, and as we'll discuss for the EPSL could cover that first 2 weeks such that the employee ends up getting paid for the entire 12 weeks. That would be the employee's option, and that would only apply if it is a COVID-related situation. So we'll talk about that. The EFMLA provides for pay to employees for weeks 3 through 12 at 2/3 regular rate of pay over the last 6 months. The regular rate of pay is the same definition as the FLSA. So it includes all non-discretionary bonuses, and it is capped at $200 per day. The employer cannot require, and this is very important, and this is an area where we get a lot of questions, the employer cannot require employees to supplement with other paid leaves. An employee cannot demand to do so. It must be by agreement between the employer and the employee that the employee may supplement with other types of paid leave provided by the employer. And I won't go into too much detail on this slide. I want you guys to just know, basically, as issue spotting, that the EFMLA provides that healthcare providers and emergency responders may not get the leave under the Act. The DOL can outright deem them ineligible under the regulations, or just define the terms and give businesses the option of denying the leave. The reason for this being that we want to make sure that we are well equipped with healthcare providers and emergency responders right now when we need them. And if you have any more questions about this, of course, we're happy to help, but I just want to make sure you understand that there is a distinction for healthcare providers and emergency responders under the Act. All right, so I put together this little chart, really started to kind of put, sort of the left side for employer health, how the EFMLA helps employers, and how it helps employees, or favors employers, favors employees. And so I just kind of want to make sure you understand the contours here. On the employer side, the DOL has indicated that intermittent leave must be by agreement. We get a lot of questions about that. Does the EFMLA apply intermittently? That it can if the employer and the employee agree on it, but the employee does not get intermittent EFMLA by design of the statute. Now, it may work to the employer's benefit to allow the employee to have intermittent leave under the EFMLA if the employee can at least telework for a portion of the day, but then cannot for another portion. Let's just say that a caregiver is available in the morning but not in the afternoon, then the employer may want that employee to be productive and be able to allow that employee to work, and then the employee can use the EFMLA intermittently in the afternoon. If you have to close a facility, terminate, or furlough before or after the law becomes effective, then the employee's entitlement ends. I want to make sure that that is very clear. If you furlough, it's not just terminate either, because as I'm sure you all are experiencing, furloughing has become a common practice during this COVID crisis, and I can tell you that I've been practicing law for 15 years and rarely heard the word furlough used, or furloughs at all being used, prior to this situation in the private sector, but now it is quite common under the circumstances and for good reason. If you furlough an employee, they are not, or if you close the facility or terminate, they are not eligible for the paid leave. You can and should require documentation from employee attesting to the reason for the leave. Now, if you think about this from a practical perspective, I definitely think there was an inclination not to require paperwork if the kids are out because of school closures, because anyone can look online and say, oh yeah, sure, this employee's kid's school's closed, that's obvious. Well, you want to make sure that you are getting supporting documentation from the employee, because when you go to apply for the tax credit, you need to be able to show the reason why you were paying these employees to be out and that you have followed the terms of the Act. And that's why you need the documentation. It's not because you don't believe your employee, it's because you need it to prove up the amount you gave the employee for purposes of the tax credit. So please make sure that you are getting documentation from the employee. On the employee side, and this is a pretty big one for the employee. If an employee says they cannot telecommute then they cannot. Meaning that you do pretty much need to take the employee's word for it that they cannot conduct their work through a telecommuting basis because of their childcare responsibilities. The burden does seem to lie with the employer to somehow prove that the employee isn't using it for that, and you have to be very careful about stepping into those waters. So by and large, you can inquire about the employee's circumstances, certainly, as to why they've suddenly become the caregiver, and why there isn't anyone else to help, and ways that you could possibly look at things like intermittent leave or teleworking. But once they've told you they can't do it because of their circumstances, then you need to trust that that is the case, unless you have a very good reason to suspect that there's some kind of fraud involved. All right, let's talk now about the Emergency Paid Sick Leave Act. So the portion we just talked about was the family portion of it, or as we're calling it, the schools out paid leave. Okay, that is that bucket. We are moving on now to the next bucket, which is the actual Paid Sick Leave Act as it relates to the COVID, the circumstances specifically related to COVID and the effect of COVID on the individual's personal circumstances. So under the EPSL, that also applies to employers with let me back up. Employers with 500 or more employees can offer EPSL, okay? So just like the EFMLA, it only applies to employers who have 500 or less employees. That doesn't stop larger employers from complying with the terms of the Act, but they are not going to be eligible for the tax credit. All employees are eligible for EPSL. Length of employment does not matter. So this differs from the EFMLA, and it differs from pretty much any other statute under the sun when it comes to employees. Length of employment does not matter. Unlike EFMLA provisions, there is no calendar days, hours of service, or geographic proximity requirement. There is no waiting period. All covered employees have the same obligation. It starts on day one to pay employees under the EPSL. The EPSL can be used under any of these bulleted circumstances. It can be used if there is a state or local quarantine or isolation order related to COVID-19. Now, note that generally speaking, a shelter-in-place order is not a quarantine or isolation order under the statute. So that alone doesn't necessarily meet the definition of quarantine or isolation order. Self-quarantine at a healthcare provider's advice related to COVID-19. This is a situation where an employee has been told by a healthcare provider that they have to self-quarantine because probably they have been in close contact with somebody else who has been diagnosed with COVID-19, or they are exhibiting symptoms that appear to be COVID-19, but the doctor has just said, hey, you just need to self-quarantine. We don't have enough tests. We don't want you coming in. We're pretty sure this is what you've got. Wait it out and let's see if it gets worse. It applies in that circumstance. It applies when a person is experiencing COVID-19 symptoms and in the middle of seeking a medical diagnosis. It applies when you are caring for an individual, or the employee is caring for an individual subject to a quarantine order or self-quarantine order, like what we just discussed. It also applies when a person is caring for a son or daughter whose school or place of care has been closed or whose child care provider is unavailable. So it overlaps here with the EFMLA. And then it applies when experiencing a substantially similar condition as specified by the Secretary of Health and Human Services, in consultation with the Secretary of the Treasury and the Secretary of Labor. That is a long way of saying it likely applies when a person is experiencing COVID-related symptoms but has not been diagnosed with COVID. So it applies in all those situations. As a side note, we get a lot of questions about, well, what can we require from an employee to prove that they have been diagnosed with COVID or that they have been required to self-quarantine? Doctor's notes are great. However, they are not as easy to obtain under the circumstances right now. And so you will want to use your best judgment under the circumstances. The employee may not be able to get a doctor's note to substantiate their need for leave, and if they can't, then you should not deny it unless you have a reason to believe, and it needs to be a very good one, that there is some kind of fraud going on, such that really you can prove it. Otherwise, you need to give the employee the benefit of the doubt. And you want to do that for health-related reasons anyway, because you don't want someone with COVID-19 or COVID-19 symptoms in your workplace. So the ESL leave, the EPSL leave, is available for full-time employees for 80 hours. So it is 80 hours of paid leave. So for people who have said, oh my gosh, I can't tell when the EPSL applies, when the EFMLA applies, well, if a person qualifies for EPSL leave, it is only for the first 80 hours. And so someone could have the EPSL leave qualify because they fit into one of those bullet pointed circumstances we just described, and then their first 2 weeks out are paid at EPSL rates, and then if they are out due to school closures continuing for the next 10 weeks, then they get paid at the EFMLA rate, okay? So you can actually get both types of leave, but just so you're aware, the EPSL leave pay is only for 80 hours for full-time employees, and then for part-time employees, they get the number of hours they work on average over a 2-week period. For example, if a part-time employee averages 24 hours a week, then they get 48 hours of EPSL leave. For part-time employees with variable schedules, the available EPSL hours should be calculated according to the formula of their average daily hours scheduled in the 6 months prior to use of EPSL, or if they did not work for 6 months prior, a reasonable expectation of average daily hours scheduled upon hire. So there you see again the DOL relying on us to make a reasonable good faith estimation about something under the circumstances. Unlike the EFMLA, for those first 2 weeks, all EPSL is paid. The pay is calculated at the higher of regular rate, federal minimum wage, or local minimum wage, inclusive of commission, tips, or piece rates. However, the EPSL is capped. It is capped at $511 per day, and it's $5,110 in the aggregate. But employees absent for care for others or school closures and similar conditions receive 2/3 of their regular rate, capped at $200 per day, $2,000 in the aggregate. To summarize and break this down, if someone qualifies under both the EPSL and the EFMLA because the reason for the absences is related to school child care closures, then they receive the 2/3 pay capped at $200 per day, $2,000 in the aggregate. If they are out because of any of the other EPSL qualifiers related to COVID, then they get the $511 per day, $5,110 in the aggregate for 80 hours. And then it ends. So I know it's complicated. Hopefully, if you're not completely following this explanation, you can go through these slides in your particular situation and see how this plays out. And of course, I'm happy to answer any questions. So under the EPSL, what kind of notice does the DOL require? Well, the FFCRA states that after the first workday that the employee misses and claims EPSL for, then they have to follow reasonable notice procedures, which would probably be outlined in your handbook. But the strange thing is the FFRCA contains no explicit provision for what kind of notice is required before the first workday that they missed because of a COVID-related reason covered by the Act. And so really, again, the DOL expects you to be reasonable here. Employer policies requiring advance notice should be reviewed and provide for advance notice only when reasonable under the circumstances. And so if you've got someone who has COVID symptoms and they overnight have to go to the hospital and are on a ventilator, well, they probably were not able to give what would otherwise be reasonable notice under the circumstances, but you should not act on that because they could not give you the advance notice. But if they can give you the advance notice, they should be following normal call-in procedures. Unused EPSL does not carry over to subsequent years. EPSL is not required to be paid out at termination, resignation, retirement, or any employment ending act. So in terms of pre-existing policies and other paid leaves, so of course it is making people's heads spin just the fact that we suddenly have paid leave at a federal level when we've never had that before. It falls under two different statutory schemes that overlap in some areas, not in others. It has different pay schemes depending on which category the employee falls into. It piggybacks off of statutes that are already in place that we're also supposed to use in conjunction with these paid sick leave new legislation. And then on top of that, we have to consider how our pre-existing policies and other paid leave factors in to the FFCRA requirements. That will make your head spin, and it has been making all of our heads spin for the last month. Here is our guidance on pre-existing policies and other paid leave. The final version of the FFCRA removes a provision requiring paid sick leave be provided in addition to other paid leave. I remember when I actually looked at the bill before it became law and I noticed this provision and I thought, oh my goodness, that's going to be so difficult for employers to have to pay their regular paid leave that they may have under their existing policy and the EPSL. But they took that provision out. However, the DOL's Q&As clarify the FFCRA's EPSL provisions impose a new leave requirement on employers, as we've discussed, and employers may not require use of other paid leave before use of EPSL. So you cannot require, if you have a paid leave policy of some kind at your company, you cannot require the employee to exhaust that first before they take the EPSL. The EPSL gets used first before any pre-existing leave obligation that the employer has. So this is how the EPSL and the EFMLA interact, and we've already talked about this a little bit, but here's some more clarification. The EPSL and EFMLA provide leave when an employee's child's school or child care provider is closed. So they both apply in that situation and when the child care provider is unavailable due to COVID-19. By the way, that is a very broad interpretation. I had one client who asked if that counts when the child care provider is a grandparent and the grandparent is unavailable because the grandparent is taking care of another family member that has COVID-19. Does that count for purposes of the Act? Yes, it does. The DOL Q&As clarify employees may be eligible for EPSL and EFMLA, but only for a total of 12 weeks. And I think that this is really important because there were a lot of questions when the legislation was passed and before there were FAQs on this topic. Can the employee actually get 14 weeks of leave because they get 2 weeks or 80 hours of EPSL and then 12 weeks of EFMLA? That has been clarified by the DOL that the employee can only get 12 weeks total of paid leave, not 14 weeks. EPSL provides for an initial 2 weeks of paid leave, which are unpaid under the EFMLA, so the employee can be under both types of leave, but only getting paid under the EPSL for the first 2 weeks. After 2 weeks or 10 days, the employees receive EFMLA at a 2/3 regular rate for the next 10 weeks. That's when they are on the schools out leave and they get the lower rate of pay. So the most an employee can get, the higher rate of pay of the $511 per day is for 80 hours or 2 weeks for full-time employees and under the formula for part-time employees and employees who are not scheduled regularly under that formula that we've already discussed. All right. We're going to talk briefly about the tax credits under the Act. I'm sure a lot of you are thinking, okay, great, we're now going to be paying employees who are on leave, and it's really complicated. So hopefully there's a light at the end of the tunnel. Well, there is, because there are tax credits available to employers who have 500 or less employees and who are providing this paid leave under the Act. I'm going to go over the basics of the tax credits. Happy to talk in more detail, but the tax credits, we could do an entire seminar just based on the tax credits, and so that is something that we can talk about offline, but I at least want to give you sort of a primer of how the tax credits, the benefit mandates, and the tax credits work. Let me go through the benefit mandates quickly. So under the Act, it requires all group health plans to provide coverage for novel coronavirus testing. So you need to make sure that you know that your group health plans have to provide coverage for coronavirus testing. This includes grandfathered plans, and it's already in effect. It took effect in March 18th of 2020. The Act also prohibits any cost sharing, including deductibles, co-payments, or co-insurance requirements, and it prohibits group health plans from imposing any prior authorization or medical management requirements for covered services. This is expansive. The group health plans must cover in vitro diagnostic products and administration for detection of the coronavirus, corona-approved, cleared, or authorized by the Federal Food, Drug, and Cosmetic Act. It must cover items and services furnished to patient in course of specific types of healthcare visits that result in order for or administration of a test. And they only have to cover to the extent that items and services relate to furnishing or administering the tests, or evaluating participants to determine whether a test is needed. There are specific types of visits covered include healthcare provider office visits, urgent care center visits, and emergency room visits. And this also includes, by the way, telehealth visits. The Act does not require the group health plan to cover the coronavirus treatment without cost sharing or medical management. IRS Notice 2020-15 permits group health plans to cover both testing and treatment on a first dollar basis without affecting the eligibility of participants to participate in health savings plans. As I mentioned, I just wanted to touch on the benefits piece of it and certainly can provide more detailed guidance as appropriate and needed. Just let me know. On the tax credits for wages, the tax credits apply to employers with fewer than 500 employees. They are eligible for tax credits on amounts paid to employees who go out on qualified EPSLA or EFMLA. They are also eligible for costs to maintain health insurance coverage for employees during that period of leave. The basis for the tax credits is that payments are not considered wages subject to Social Security tax or Medicare tax, and the employers receive refundable credits toward the employer's quarterly share of these taxes. For the EFMLA leave credit, the credit is equal to the amount the employer paid during the first quarter, subject to certain limits, up to $200 per day of EFMLA leave, which makes sense, and capped at $10,000 per employee for the entire leave period. So this is in line with what the employee gets paid under the EFMLA, which we discussed earlier. For the paid sick leave credit, the EPSLA credit is limited to 10 days total per employee. Again, this makes sense because that's the amount of leave the employee can get under the EPSLA. And the limits on the credits depend on which tier the employee falls into. Tier 1 is if the employee is caring for a child due to school closure, isolation or quarantine, or substantially similar circumstances. Those are the bullet points that we talked about earlier that fall into Tier 1. Tier 2 is the employee is quarantined or isolated per federal, state, or local order. Employee is advised to self-quarantine by healthcare provider, or employee is seeking symptoms and seeking medical diagnosis. Tier 1 absences, the credit limited to $200 per day. Tier 2 absences, credit is limited to $511 a day, plus qualified health plan expenses allocable to the emergency paid sick leave. The process for claiming the credit is that on March 20th, 2020, the IRS announced employers can retain and access funds they would otherwise pay in payroll taxes. If this is not sufficient to cover the cost of the paid leave, employers can seek expedited advice from the IRS by submitting streamlined claims forms. Here is an example of how this works. An eligible employer paid $5,000 in qualified sick leave. They were required to deposit $8,000 in payroll taxes, including taxes withheld from all employees. Employer could use up to $5,000 of the $8,000 of taxes as a credit for qualified leave payments, employer is only required to deposit the remaining $3,000 on the next regular deposit date. Example 2, eligible employer paid $10,000 in qualified sick leave. They were required to deposit $8,000 in payroll taxes, including taxes withheld from all employees. The employer could use all $8,000 of taxes as a credit for qualified leave payments and make no tax deposit on the next quarterly tax deposit date. And the employer could file a request for an expedited advance for the remaining $2,000 on the IRS form. So hopefully these examples kind of help crystallize how this works. Again, happy to provide more detailed guidance if you want to reach out and let me know what you need. The general rules for these credits are that they are effective until December 31st, 2020. They take effect 15 days after signed into law, so they're in effect now. The impact on Social Security and Medicare will be made up from the general fund. Once again, there is a sunrise and sunset for the credits, just like there is a sunrise and sunset for the leave obligation. It is the same dates. The effective date for the tax credits is April 1st, 2020, and it ends on December 31st, 2020. As a reminder, employers who are not covered by the FFCRA are not entitled to tax credits, even if they provide the functional equivalent of the benefits required. And the DOL has also said, from an amnesty perspective, that they will not sue if good faith attempts are made to comply with the Act by April 17th, 2020. So if you're listening to this webinar and you're thinking, oh man, I better get moving, you have till tomorrow where the DOL will provide you amnesty. Otherwise, you're going to run into some issues if you have not been complying with the FFCRA. All right, so we're coming to our last topic here, and it's interesting because the kind of counseling issues that we've been handling and working with all of our fantastic clients who are working so hard on these things has been sort of cyclical, and it has gone from, okay, we really want to understand this act, and we have been working with them to do that and updating on pretty much daily, if not hourly basis on new information as it relates to the FFCRA and everything else going on. And so I feel like people are starting to get their minds around the FFCRA. And then CARES comes out with all of these additional unemployment benefits, and everyone's thinking, oh my gosh, this is complicated, this is more stuff, and my head's about to explode. So I'm trying to, through the course of the next few minutes, distill for you what the key changes are from an unemployment perspective under the CARES Act. Obviously, a lot is state specific. And there are quite a few details. This is kind of a general overview so that you know generally what's going on with unemployment, and you're able to spot issues and make decisions about how you're going to handle it going forward with your employees. So, key changes to unemployment through the CARES Act. There are several. This one I'm just going to kind of bring to your attention as an issue spotting. If you work for a government agency or a nonprofit, you're probably a reimbursable employer. If you don't know what I mean by reimbursable employer, then you probably aren't one. And you probably don't work for a nonprofit or a government agency. But a reimbursable employer basically means that you don't pay into the unemployment system, but you basically pay on a per person amount depending on how much each employee uses in unemployment. So you don't just have a pot of unemployment. It really is per person that you are reimbursing the government. Under the key changes to the CARES Act, for those that are reimbursable employers, they now only pay back 50% of what the former employee utilizes in unemployment, as opposed to the full 100% that they were having to pay prior to the act going into place. Like I said, that probably doesn't apply to most people who are listening to the webinar. So another key change is that under the CARES Act, the Congress has basically incentivized employees to get rid of the waiting week waiver. So you probably already know that in most states, there is a waiting week where employees are not eligible for unemployment after they've been terminated. The CARES Act provides funding to states for the coverage of this initial week of unemployment, basically incentivizing them to waive that waiting period for that first week. And I think all states have now complied with that, and none of them currently have waiting weeks for employees who are collecting unemployment. Why do we care about that? Because it's the federal government who is paying for that additional week and not the actual state. I think this is probably the biggest change, at least on this slide, for unemployment under the CARES Act. So under the CARES Act, employees now get $600 per week in additional unemployment for 16 weeks on top of the state unemployment that they are eligible for. And this is obviously a huge increase for employers in Texas. It more than doubles the amount that an employee is potentially eligible for on a weekly basis. The new unemployment benefits also expand to a group of individuals who otherwise would not have been covered under unemployment, and we're going to talk about that in just a second. And then it also extends unemployment benefits by 13 weeks. So in Texas, our unemployment normally is 26 weeks, and now it has been extended to 39 weeks within which employees can collect unemployment. 16 of those weeks have a $600 adder courtesy of the federal government. So as I said, more people are now eligible for unemployment. So it both expands the classification of people who are eligible for unemployment, and it also expands the reasons somebody can get unemployment. So on this particular part, it expands the people who are now eligible, and it includes business owners, self-employed individuals, independent contractors, gig workers, those with a limited work history and history of wages earned, and individuals covered under state UI after state UI has been exhausted. Apply with the state agency where they live and self-certify they are otherwise able to work, except that the individual is unemployed. Okay, so this is the second category of individuals who have to self-certify that they otherwise would be able to work where they are, but they're unemployed for the following reasons. These reasons are going to look really familiar because we've been talking about them for the last hour and 15 minutes. They're largely the same reasons. So for the reasons that employees can now get paid sick leave under the EFMLA and the EPSLA, they can also get unemployment benefits under the CARES Act. If they are diagnosed with COVID, have COVID symptoms, household member has COVID, providing care for someone who has COVID, schools or daycares are closed and they can't work due to a quarantine, they've been advised by a healthcare professional to self-quarantine, they were scheduled to commence employment but now can't as a direct result of COVID. So a lot of employers are having to push off offer letters and offer start dates for employees, so they would follow within those circumstances. Individual has become a breadwinner due to the death of a head of household due to COVID. Individual had to quit a job as a result of COVID, and we're going to talk about that in a second because that is certainly a hot topic right now. the place of employment is closed due to COVID. And then if the individual is self-employed or is seeking part-time employment but doesn't have sufficient work, then they may qualify under the state unemployment program. We'll talk a little bit more about that in a second. Individuals who are able to telework with pay or who are receiving sick leave or other paid leave benefits are not eligible. Critical point, employees can't double dip. Also, if they can telework, then they are not eligible, which I know and I'm already seeing and I'm already hearing that this is an area fraught with problems because we're supposed to trust that an individual cannot telework. If they're telling us they can't, then they get the paid sick leave. Are we supposed to do the same for the unemployment? Well, as you all know, for purposes of Texas, the Texas Workforce Commission is going to evaluate that. And so if you feel like an employee can telework and they're not, because then they're going out and trying to claim unemployment, then you need to contest the unemployment. We'll talk about that in a moment. Another key change is that the unemployment is now expanded for 39 weeks. So now in Texas, employees are eligible for unemployment for 39 weeks. Again, this only applies through December 31st of 2020, although it certainly could get extended. In terms of the additional money, they are entitled to an additional $600 per week for up to a total of 16 weeks for 4 months, but only until July 31st, 2020. So this $600 a week is not through the end of the year. It is through July 31st, 2020 at this point. This is an exponential increase in the amount of employment assistance that an individual can receive. We are getting questions about when this additional benefit will be eligible. Well, in some places, it's already happening. I've already heard from members of my family in various other states that they're already getting the extra $600 a week. So in Texas, I have not heard whether or not this is happening yet, but if it isn't, it should be any day now. I know the Texas Workforce Commission is working hard to make sure people are getting those supplements, but the way this works is that each state has to enter into an agreement with the federal government about how this works, and I can only imagine what an undertaking that is. So if there's a delay, then that is the reason. So I feel like we have covered most of what is on this slide already. The unemployment benefit how long it will last does vary by state because, Texas is 26 weeks for unemployment regularly. Most states are. There's some states that are less. I know randomly South Carolina is, I think, 20 weeks or 23 weeks, so their total is going to be less than Texas. The CARES Act extends total unemployment here to 39 weeks in Texas. The state benefits exhaust first, then the impacted individual becomes eligible for additional benefits for the remaining time period. This is about to be the $50 million question. Does that mean it is possible for an employee to receive more money if they are unemployed than if they keep their job? And the answer is yes. Every person on unemployment will receive state unemployment or the CARES supplement if they don't otherwise qualify under the state definition, plus $600 a week for up to 16 weeks until July 2020. If you are eligible for even $1 in unemployment under the state qualifications or the extended qualifications under the CARES PUI, then you get $600 a week. So this is the question that is quick to follow by employers, and understandably so. We're already seeing this becoming a problem. So can an employee quit to collect unemployment because, from the employee's perspective, they're going to make more money on unemployment than they are working? That creates a really big problem for essential workers. Well, here's how we deal with that. The employee is probably not eligible for unemployment if they quit unless they have a reasonable basis for doing so. In the COVID context, a reasonable basis likely would be if they have an underlying health condition and are immunocompromised, if they are older than 65, which places them, those two qualifications place them in the high-risk categories. If those employees can show that they are in the high-risk categories and that going to work, they're afraid to go to work because of that reason, it is likely those employees are going to qualify for unemployment as it stands right now. Also, another reasonable good faith belief basis could be that there has been a breakout of COVID-19 at the workplace, and or there is some OSHA violation that the employer is doing that is a reasonable reason why an employee would quit and not want to go back to work. However, absent these circumstances, a generalized fear of COVID would not be enough in and of itself, most likely, for an employee to collect unemployment. So what does that mean for you as the employer? Well, what it means is when an employee comes to you and says, I'm quitting because I'm scared to be in the world and out of my house and not sheltering in place because of COVID, you want to make sure that you're asking questions about why they are afraid. If they tell you it's because of one of these 4 bullet points, then that's probably going to be a reasonable good faith belief. If they tell you that it's something that you're not doing as the employer that's making them nervous or afraid, you need to do what you can, and certainly what the law requires, to make sure that that employee is safe. Possibly, if that employee says to you, well, I think so-and-so was exposed to someone who's come into close contact with someone who has COVID and I'm worried, okay, well, maybe the employee just needs to stay home and self-quarantine for a period of time. You just need to show that you have done everything you can to alleviate that employee's fears and that you've done everything the law requires to make your workplace safe. If you check all those boxes, then you can let the employee know, listen, we are going to say to the TWC, for example, that you have resigned, and you're going to have to show them that you resigned for good reason or you're not going to be eligible for unemployment. Just so the employee knows that, hey, you can't just quit because you're scared generally of COVID and expect to collect unemployment. You've got to have a reasonable good faith belief for doing so. The federal government has already told us that they know that this is an area that could be fraught with peril for circumstances of fraud, and the employer has the right to ask questions to ascertain whether or not that employee has a good faith belief, and also ask questions under the ADA regarding medical documentation and representations related to when an employee says they've been diagnosed with COVID. If I reduce the hours of my employees, are they eligible for unemployment? The answer is yes/maybe. So in large measure, it depends on how much you've reduced their unemployment or their hours by, and whether they're exempt employees or not. So in Texas, it's typically a 20% reduction in hours is considered enough to at least allow an employee to resign. So in Texas, we believe that an employee will be eligible for partial unemployment if they are partially unemployed, if they've had a reduction in work hours, and I'll show you the formula in a minute. The question is not one of qualification for unemployment, but rather one of offset. How much will their unemployment be offset by how much they're working? Every state is different. I'm just going to go over Texas. If an employee is making any money from any source, weekly unemployment benefits will be offset. That's just a general rule for unemployment that, as far as we know, is still at play. So here's a partial unemployment calculation in Texas. If the employee doesn't quit, the employee is only entitled to partial unemployment where a reduction in hours has caused the employee's weekly pay to drop below 125% of the weekly benefit amount that she would receive if she were totally unemployed. And then here's the calculation of how partial unemployment is calculated in Texas. An employee cannot go over the weekly benefit amount, I should have maximum in there, maximum weekly benefit amount of $521 in Texas, or they are not entitled to unemployment. So please keep that in mind. This is where we run into snafus about whether or not exempt employees can be eligible for unemployment, because if they meet the salary basis test under the EFMLA, I can tell I'm getting tired of talking. If they meet that salary basis exemption of $684 per week, then they're already making more than $521, regardless of whether or not their hours have been cut. And so a lot of employers are reducing exempt employees' hours and even reducing salary, but keeping it above the $684 a week to make sure the exemption still applies, and then asking whether that employee is going to be able to receive unemployment because they have had a reduction in their salary. Well, the answer to that question normally under normal TWC guidance is no, that employee would not be eligible for unemployment. However, they may be eligible now, and that's something we're waiting on for. We're waiting for guidance from the TWC on whether they're going to change that rule for exempt employees. Also note, however, that there's a Texas Workforce Commission has a work share program that employers can opt into and basically work with the TWC to supplement employee income through the Unemployment Commission. And the way that works is that you actually are the one who is reporting your employees who should be eligible for unemployment, who've had a reduction in pay, had a reduction in hours, and then the TWC will work with you to supplement their income through that work share program. And I think, and we've heard sort of anecdotally, that under the work share program, exempt employees can be eligible for partial unemployment if their salary has been reduced. I'm showing you now, for you national employers, the states that have work share programs in place currently. Some of you may already be working with the TWC on work share. So we are coming to the end of the presentation. I just want to point out that you cannot typically supplement your employees' wages while they are on unemployment. No state allows for that. Some states do allow an employer to pay supplemental income to employees in the form of PTO, bonus, or severance. And an employer can pay health insurance without impact to unemployment. Huge question, right? Because a lot of employees who are collecting unemployment right now are furloughed as opposed to laid off.
they're still employed by the employer, but they just are not getting any hours or getting substantially reduced hours. You can still pay their health insurance or their COBRA and they can still collect unemployment. All right, this is my last slide. I just want to wrap up by giving you all some more things to consider because I haven't given you enough already in the hour and a half that we've been talking. So make sure as you are making workplace decisions about what to do with your population that you are considering these incredibly critical bullet points, because I have spent the better part of probably every day for the past over a month talking to companies, big companies, small companies, about how to manage their workforce during this time, and in particular, whether to furlough or lay off, and what the considerations related to those decisions are. And the things that you really want to be remembering are, is there a wage and hour issue on what you're trying to do with your employees, whether it's furlough or reduced hours or what? Are their benefits impacted? This is a huge, huge, huge question. Are they going to have to go on COBRA? Does your plan allow employees to not be working hours and still be covered? Okay, that's the first place you want to look if you're even thinking about doing a furlough. Does the WARN Act apply, or any of the state mini WARN Acts apply to the action that you are taking? There are state notice requirements of changes to pay. I can't tell you how many times I've been on the phone with people and they're telling me what they want to do in terms of changing employees' pay on a national level. And I say, well, when do you want to do this? And we're talking on Friday, and they say Monday. And I say, well, you can do that in some places, but there's states where you can't, because there's a requirement that you give employees 7 days notice or 10 days notice. So that's something you need to know. You need to make sure that you're following predictive scheduling guidelines. You can't just be all over the place on how you're scheduling people. PTO and leave payouts, probably in the top 5 of issues I've counseled on, particularly on a national level, when it comes to how to implement these types of employment decisions, whether or not you have to pay out PTO in certain states, whether you have to pay out PTO under certain circumstances. And it's not just the general umbrella of PTO. As you all know, there's plenty of jurisdictions out there that have sick leave laws that are in place that you need to consider. So there's a lot of moving parts there, and you want to make sure that you don't forget about that. And then make sure that you are giving notices of unemployment. So I just have 2 more quick slides. Yes, you have to give notice of unemployment. And I just included this last slide here about whether an employer can or must file an unemployment claim on behalf of its employees. Georgia is the only state that requires it right now, as far as I know. Other states may request that employers file, and during a work share program, an employer is the one who is filing on behalf of the employees. So thank you all so much for your time today. I really appreciate it. I know this is dry stuff, but incredibly important. And if you have any questions about anything, please don't hesitate to reach out. And I also put up here our coronavirus resource center on our website. I'm not gonna brag or anything, but I have heard from lots of clients that we have the best stuff. So please feel free to check out our resource center if you have questions about anything. Thank you so much for your time.
Eva, I would like to say thank you for taking time out of your hectic schedule to help us think through the next steps and prepare for the future. Based on the attendance, I would say they thought you were very, very good. We held your audience, and that tells me the information is extremely valuable and extremely timely. So thank you.
Wonderful. Thank you all very much.
You're welcome. Just as a reminder, this webinar is brought to you by chambers from across East Texas. and we will continue to work together to bring you relevant information. Again, thank you for being with us today, and goodbye.